Sheila thought she had made it. After years of grinding for a middle management job in a mid-sized city, she and her husband had settled into a comfortable life. 2 kids, a mortgage, and a decent benefits package. Her employer offered health insurance, and she dutifully enrolled her family in what she assumed was protection, the kind you rely on when someone gets sick, when emergencies happen, when life throws a curveball. But then the bills started coming. At first it was incremental, a few $100s for a specialist visit, a prescription her son needed for a chronic condition. She paid her deductible, then co-pays. It added up. She knew it would. Everyone told her healthcare was expensive, but she hadn't realized just how expensive, how fragile that protection really was. One day, she looked at her bank balance and realized that she was paying more out of pocket than she ever had in rent. The safety net she'd believed in was woven from brittle threads. Across America, hundreds of thousands of people like Sheila are facing that same reality. Their employers have promised insurance, their paychecks feel steady, but their healthcare system is punishing them. Premiums are soaring, deductibles are climbing, and cost sharing is becoming a grinding burden. For the middle class, those who don't qualify for government health programs yet don't have deep enough pockets for luxury care, the promise of health insurance has become more of a trap than a safeguard. Insurance, after all, is supposed to protect. But today, being insured often means being on the hook for thousands of dollars before you get a cent of real benefit. According to the latest survey, the average annual family premium for employer-sponsored coverage has jumped to nearly $27,000. Meanwhile, workers chip in more than $6,800 from their own pay. Even after that, the deductibles remain steep, nearly $1,900 on average for single coverage. And more than a third of workers are in plans where the deductible is at least $2,000. It's not just the premiums. A rising share of families are enrolled in so-called high-deductible health plans, which shift the financial risk onto the insured. That means more of the burden lands on ordinary people, especially those who are caught in the middle, making too much to get substantial help. But not enough to comfortably absorb every medical bill that comes their way. Prescription drugs are a major culprit. Employers themselves admit that prescription costs, especially expensive, cutting-edge treatments like GLP-1 weight loss drugs, are driving premium increases. This isn't hypothetical. People are demanding these drugs, firms are paying for them, and insurers are passing on those costs to workers through higher premiums. The drugs may help when used properly, but their price tags ripple across the entire system. As more people rely on them, the average cost of coverage climbs, and the middle class takes the hit. Then there's utilization. People are going to the doctor more often, managing chronic diseases, using mental health services. And all that is good, in some sense, for public health. But it also means more spending, more strain on insurance plans, and ultimately more cost pushed to the insured. The logic of premiums and underwriting doesn't reward prevention nearly as much as it penalizes the use of care. That tension puts middle-income earners in a bind. If they try to stay healthy, they might pay more. But if they avoid care because of cost, they risk far worse health outcomes down the line. Worse still, underinsurance has become real. Many Americans may have health plans, but those plans don't protect them from financial ruin. Their deductibles, coinsurance, and out-of-pocket maximums are so high that a serious illness or a hospitalization could wipe out a year's savings. As a result, some middle-class families avoid care, delaying visits or skipping treatments entirely. And when they finally seek care, often at the worst possible moment, they're forced to pay out of pocket or go into debt. Debt is the silent killer in this story. Middle-class Americans often carry more medical debt than the poor or the very rich. Studies show that even insured people in the middle income bracket are carrying unpaid medical bills. Some statistics suggest that over 20% of insured middle-class patients are dealing with medical debt. These aren't people who eschew care because they lack insurance. They are people who used their coverage, believed they were protected, and still got buried. That debt doesn't just vanish. It affects credit scores, mental well-being, and the ability to finance a home or save for retirement. It changes how people live, delaying milestones, refusing to plan long-term, or making decisions based on what medical bills might be coming next. And once it goes to collections, even forgiving that debt has limited benefits. Studies show it does little to improve credit scores or reduce future financial stress, because the root problem wasn't bad debt collection, but the healthcare model that allowed the debt to build in the first place. These economic pressures also ripple into work. When healthcare costs increase, some employers pass those costs to their workers through higher payroll deductions. Others shift to more aggressive cost sharing or strip out benefits. In some cases, rising healthcare costs influence hiring decisions, compensation, or even cut jobs. The burden doesn't just feel personal, it feels systemic, a weight on the workforce that slows growth, jitters financial stability, and feeds a cycle of uncertainty. But it's not just about numbers, it's about power, fairness, and dignity. Imagine choosing a job not just for your career path, but because of who pays your health insurance. Imagine building a life, having a child, worrying constantly about whether you can afford the next hospitalization. That's a stress many Americans carry, quietly, while doing their best to contribute, vote, and build a stable future. And now, the stakes may be about to rise further. Key subsidies that have made marketplace plans more affordable are set to expire. These subsidies capped how much people pay for their premiums relative to their income. Without them, many middle-class families could see their costs surge, potentially doubling in some cases. The cliff isn't far off, and experts warn that millions could lose coverage or face untenable financial strain if Congress fails to act. Meanwhile, the structure of health insurance itself hasn't been reimagined in decades. Insurers still rely largely on traditional models, risk spreads across populations, but premiums and cost sharing often focus on individual risk. There's pressure, but not enough leverage, to radically change how care is paid for. Hospitals negotiate rates with insurers, prescription drug companies set high prices, chronic disease costs continue to rise. Everyone in the system feels squeezed, but the middle class ends up squeezed the hardest, paying premiums, paying bills, and still not fully protected. Despite the pain, there is hope. Some reforms could ease this burden, extending tax credits, restructuring cost sharing, or introducing public or all-payer options. Some ideas center on value-based care that rewards prevention and long-term outcomes. Others propose income-adjusted deductibles or more aggressive regulation of drug prices. These aren't silver bullets, but they are levers. Until then, though, families like Sheila's will continue doing the math, balancing premiums, out-of-pocket costs, and the risks of being underinsured. They'll choose whether to delay care this month so they can make rent next month, or whether to switch jobs to find better benefits. They'll pray that a diagnosis doesn't spiral into debt. That's not how insurance is supposed to work. But in the United States today, for many middle-class Americans, it's the only option they have. And that's the bitter irony. You can have coverage, but still be unprotected. You can pay for insurance, but still be punished by healthcare. For millions of people in the middle, working hard, doing their best, counting on the system, The dream of security has become a gamble, and the system meant to guard them has become one of their greatest risks.